Breathing slowly through your nose sounds too simple, especially if you're recovering from a concussion. But what if I told you this overlooked tool done right could actually help you restore your nervous system, sharpen your focus, improve your sleep, do all the fun things you want to do after a concussion recovery? So if you're dealing with brain fog, poor sleep, or anxiety after a concussion, slow nasal breathing can literally change how your brain and your body talk to each other. And so here's why skeptics of this are wrong. Let's get into it. I'm Dr. Mark. I'm a naturopathic doctor who specializes in concussion and athletic performance. Over the last 5 years, I've worked with everyone from pro athletes to active teens to high-performing adults and entrepreneurs. And yes, one of the most underrated tools that we use is breathing. Research consistently shows that slow nasal breathing, less than 10 but around 6 breaths per minute, activates your vagus nerve, increases parasympathetic tone, boosts your heart rate variability. All of these are key metrics for restoration and recovery. It's not just calming down, it's actually restoring regulation and the ability to regulate. When we look at brain studies during slow breathing, we actually see increased alpha wave activity. So this is the same pattern you see in sort of like a calm, clear, meditative state. We'll see increased visual acuity, we'll see faster reaction times. When we actually measure in the brain, we see increased or like improved oxygenation, better blood flow through the prefrontal cortex. And this is part of your brain that controls focus, emotion, executive function. All things that we want to see after concussion. So why does this matter? After a concussion, your nervous system gets knocked out of rhythm. A concussion is a functional traumatic brain injury. So this knocked out of rhythm includes systems that control your heart rate, your breathing, your stress responses, your cerebral brain blood flow. You might feel wired and foggy at the same time. And that's not just like mental psychology, that's your neurobiology. So here's what's happening. After a concussion, we see across multiple studies, we see that breathing often becomes faster and more shallow. So you're not hyperventilating, but it's sort of this background. If a normal respiratory rate is between 12 and 20 breaths per minute, you're closer to 20. You're blowing off CO2 faster and you're lowering carbon dioxide levels. When CO2 drops, your blood vessels constrict, they get slower, which can reduce oxygen delivery and make your symptoms a little bit worse. And this is where slow breathing comes in. When you breathe at 4 to 6 breaths per minute, around 6 breaths per minute is a sweet spot, you actually raise your CO2 levels slightly, which helps you dilate your cerebral blood vessels and improve blood flow to the brain. There is way more nuance to that. If you're like versed in the concussion world and blood flow, that was way simplified, but just hang with me. So when we're doing this, we're not just relaxing, we're actually recalibrating our brain's sort of like internal blood flow thermostat. And yes, I have had more skeptical, usually dads and husbands, but sometimes athletes than I can count, say something along the lines of like, he just wants you to breathe slow. Like when we drill it home week after week and they finally do it, we see that, oh, we're sleeping better. We're thinking clearer. We're less emotionally reactive. All the things that we just talked about actually happen. This is my favorite way to start. This is what I tell people to do. I want you to inhale through your nose for 5 seconds. I want you to exhale through your nose for 5 seconds. I don't want you to pause. I don't want you to force. I want it to be smooth, quiet, and slow. What I tell people is that from here up, if you're on a Zoom meeting, no one should know what you're doing. The only reason they should think you didn't freeze is because they can still see you blink. So 5 seconds would be, that's it, quiet. Do this for 10 to 20 minutes, once or twice a day. And here's what's happening under the hood. When you inhale slowly through your nose, your diaphragm pulls down, creating a negative pressure in your chest. That draws blood. That negative pressure actually also draws blood into your heart and improves circulation. Your ribs expand outward, stimulating stretch receptors and sending kind of like calming feedback to your brain. And then nasal breathing specifically activates nerves in your upper airway, like kind of in the sphenoid and in the upper airway here, that communicate with brain centers responsible for this autonomic regulation. So it's not just the CO2 and the O2, it's actually the mechanical ventilation of the ribs, the mechanical drawing in of blood to the heart, the mechanical stimulation of fibers in your nasal cavity. Compare that to mouth breathing, and what we'll see is nasal breathing actually improves oxygen efficiency, it stabilizes CO2 levels, and it boosts parasympathetic activity. Now let's go through 2 common objections. So the first one is 10 minutes is too long. I hear it all the time, 10 minutes is so long, it's so hard. People tell me this every single day, and if that's your reaction, congrats, grow up. We just found your training zone. You're not just training your lungs, you're training your attention, your tolerance to CO2, and your emotional regulation. If you can't sit with yourself for 5 to 10 minutes, you maybe need to consider talking to a therapist. I say that jokingly and also very seriously. Start with 3 minutes, work to 5, just do something, but the goal is 10 to 20 minutes from the stance of vagal activation and parasympathetic activity, pushing your recovery forward. Objection 2 is, what if I feel worse? This is very real. Some people feel more dizzy, more anxious, more foggy when they first try slow breathing. That's not failure, that's physiology. Going back to the blood flow and the CO2 relationship, here's where we're going to add some more nuance to that. After a concussion, your brain blood vessels can become hypersensitive to CO2, which is probably why you're blowing it off and hyperventilating a little bit. This is a phenomenon called altered cerebrovascular reactivity. And so when CO2 starts to rise during breath work or rise during physical activity, blood flow, the vessels dilate, blood flow surges, and that can feel too intense. That can be the cause of your symptoms. You can have too little blood flow cause symptoms, but you can also have too much blood flow cause symptoms. That doesn't mean it's harmful, but it does mean that your nervous system needs gradual retraining. And that's what I help people do. We'll tailor your breathing to fit your recovery stage. We'll tailor your exercise. We'll tailor your visual vestibular exercise. We'll work on your neck, nutrition, all that fun stuff. So breath work, it's not soft, it's not nothing. I consider it foundational, especially when your nervous system is dysregulated. It's not the only thing we do. Again, we stick to aerobic exercise rehab. If you're from the US, I say that pace breathing and exercise rehab are sort of like peanut butter and jelly. We also do vestibular work, cognitive training, but breath work is often where we start. Everyone gets that from day one. So if you're stuck in recovery or want to just finally start doing this right, go ahead and book a consult. I'll help you understand what your brain is probably craving and actually needs. And if you're the skeptic in the room, just try 5 slow breaths. Then tell me you didn't feel anything and it's just breathing. So if you like this video, go ahead and hit the like button, hit the bell, subscribe, do all the YouTube things. It's free for you. It super helps me and I'm super appreciative. Until next time, I'm Dr. Mark.